Good morning and afternoon, everybody. I'm so happy to be here and to share my knowledge with you all. I look forward to being a resource for you. I'm excited to do this presentation for you. I hope you learn some things today. And I'm always available separately if you have specific questions that are individual to you. I have my contact information here. If you want to jot that down, that might be helpful. Here we go. One of the things I did want to discuss with you today before I go into my slides is why working with a Medicare insurance agent, an independent agent or broker would be beneficial to you is that we are fully trained and licensed. We go through hours and hours of training and testing, and we are certified or licensed with the Department of Insurance. We can individualize plans for you. We can find the best plan for you with your specific information. I give you year-over-year updates. I am here to be your advocate if you need help with anything. You have customer service questions, I am your person to go to. I do all of this at no cost to you. We are compensated by the health plan should you choose to enroll with an agent or a broker. And you may know somebody personally that you trust and that you really like. And I encourage you to reach out to that person as well. Okay. So that being said, let's go to the slides and let's see. Oops, who is eligible for Medicare? So basically you need to be a U.S. citizen or permanent residence for 5 consecutive years. You can't go back and forth to other countries for a year and come back or anything, and you have to be here for 5 full years. Also, if you have illnesses such as Lou Gehrig's disease and stage renal disease, those types of things would allow you to you can go in to Medicare at any age. If you have a disability and you're under 65 and you're receiving Social Security disability payments, this is not regular state disability insurance. This is through Social Security disability insurance, very different. You have been receiving payments for 24 months. You will automatically be signed on to Social Security Medicare on the 25th month. So that comes automatically. Okay. Let's go to the next slide. Okay, so if you're receiving Social Security benefits when you turn 65, you will automatically be enrolled into Medicare. You will receive Medicare 3 months prior, your Medicare card, 3 months prior to your birthday. If you're not yet receiving Social Security benefits when you turn 65, you do need to enroll. You would enroll with socialsecurity.gov. Applying online is the most effective way, especially after January 21st. January 1st. They stopped accepting walk-ins, which is making it very difficult for some people. But the number for Social Security is listed here at 1-800-772-1213. And you can call and request an appointment. And they will set you up with an appointment to apply for your Social Security. But there are no more walk-ins into the office, unfortunately. That does cause people some issues. Okay, so now we're going into the basics of Medicare. So basically you have Medicare Part A and Part B. That is through your Medicare, the red, white, and blue card that you will receive once you enroll in Medicare with Social Security. Social Security Part A is hospital insurance. Part B is your medical insurance. Okay, so it covers everything. I'll get into that in just a second. I'll have more information on the next slide. You also have options after that to have additional coverage. One of those would be a Medicare supplement, also known as a Medigap plan, and with a separate prescription Part D drug plan. The other alternate is a Medicare Part C, which is your Medicare Advantage plan, which would be a PPO or an HMO. And again, I'll have more detailed information on that in just a moment. Okay, so original Medicare Part A, your hospital insurance covers things like inpatient hospital care, skilled nursing facilities, hospice care, limited home health care, and this is just to name a few things. Okay, so basically, if you have a piece of paper and a pen with you, pencil, just write down Part A equals hospital insurance. Okay, because these are where people get confused a lot. Okay. Your Medicare Part A, their monthly premium, there is no monthly premium for Part A as long as you have paid into Social Security for 40 quarters or 10 years. That would generally be off of your W-2, when you file, when you pay your taxes, when you get a paycheck from an employer, or if you're self-employed and you're paying your payroll taxes through that. So if you did not work all 40 quarters in 2024, the premium is either $278 a month or $518 a month, and it depends on how long you or your spouse worked and paid into Medicare taxes. The deductible, if you have only original Medicare, which is Part A and B with no additional coverage, your hospital deductible would be $1,676. Okay. Cost to you after the deductible, again, if you only have Part A and B and no additional coverage, part days 1 through 60 of each benefit period is $0 after you meet the deductible of $1,676. Days 61 to 90, it'd be $419 each day. After day 90, each benefit period is $838 each day for a lifetime reserve day. And after you use your 60 lifetime reserve days, you pay all costs for hospitalization. As you can see, that can get quite expensive. Okay, so there are options for that, and we'll get through that in just a moment. So your original Medicare Part B is your medical insurance, and that includes your doctor's visits and preventive services, outpatient surgeries, diagnostic screenings, emergency care, durable medical equipment. Okay, and again, this is not a complete list, but this gives you a general idea of what is available. Okay, that's for your Part B. We skipped. Okay, so there we go. So for the average monthly premium for 2025 for Part B is $185. And that's if you make a certain amount, and I'll go over the IRMAA, we call her Aunt Irma, the income brackets, and that gives you additional costs, unfortunately, sometimes if you make a lot of money. And what does that mean? We will get to that on the next slide. Your deductible, if you still have just Medicare Part A and B with no additional coverage, your deductible would be $257. The cost to you after deductible is 20% of non-preventive services, and there is no limit. So original Medicare, there is no cap on the expense that you would have out of your pocket. Okay. All right. So here is a very important slide for you to look at. If you are single and you make up to $106,000, or if you filed your taxes jointly and you make $212,000 or less, you pay that $185. If you make over $106,000, up to $133,000 on your taxes, for a single person, and $212,000 to $266,000, you would be paying $259 every month instead of the $185. And you can see the brackets go up exponentially depending on the amount of money that you make. And it depends on whether you're filing jointly or independently. And you can see on the far right side the cost that you would be paying. And this is not in addition to the $185 that you're already paying. If you make less than that, these are actually the dollar amounts that you would pay. For example, if you make over $500,000 as an individual, you're going to be paying $628.90 for that Part B premium. Now, the IRMA is based on 2 years ago on your tax filing. So this year is based on the 2023 filing, and it would be based on your modified adjusted gross income, and that is the bottom line of taxes after your tax filing. So you can look at that. Now, here's the thing, is if your income has changed dramatically, less, and somebody lost a job, you lost a major client, you're no longer in that business, or you've retired, you can apply for a reduction. It's called an appeal, and there is a process that I can talk to you separately about. And if your income has changed at any time, you do not need to wait 2 years for that reduction to happen. You can give an estimate to Social Security and let them know that you want to appeal this cost. They will do so, and then when you file your taxes for 2025, if there is any kind of an adjustment on your estimated income, they will adjust it at that time. So you can save money. You do not need to wait 2 years for this to go away. Okay, I hope that makes sense. Okay, so there's a Part B late enrollment penalty. So if you did not sign up for Part B when you were first eligible and not covered by an employer plan, you may have to pay a late enrollment penalty as long as you have a Part B premium, okay, or Part B Medicare. Monthly cost may go up 10% for each full 12-month period that you could have had Part B but did not enroll. The exception is you do not have to pay a late enrollment penalty if you meet a certain conditions that allow you to sign up for Part B during a special election period or enrollment period. So what that means is if you had employer coverage and through a spouse or your own, and you decide you want to switch to Medicare, that would be the thing to do, and that would be one of the exceptions. Okay, or if you become eligible for Medi-Cal in California or Medicaid in other states, that's where you have severely low income or extra help, then you would be able to sign up for Part B. That again would be another special exception. Okay, there are several. Those are just a couple. All right. So original Medicare without the additional insurance does not cover deductibles, copays, co-insurance, outpatient prescription drugs, healthcare outside the U.S., hearing aids, exams and screenings, routine eye exams, and most glasses. And original Medicare generally covers 80% of your hospital and medical expenses. So you would be responsible for the extra 20%. What I tell my clients when they're debating about doing, a supplemental, not a supplemental, but an additional insurance, I let them know, if you go to see a doctor and they charge you $100, it's no big deal if you pay $20. But if you go into the hospital for a major problem that's $100,000, you're talking $20,000, and that's huge. That can really hurt people. So you want to keep that in mind. It is important to consider having additional coverage. Okay, the next slide. Medicare supplements can fill in some of the gaps of original Medicare. So it can cover deductibles, copays, and coinsurance, and most of the plans do. You have the freedom to choose any Medicare appointed doctor in the United States. What that means is you can go to any doctor, any hospital, any facility, clinic, anywhere you want, as long as they have a Medicare assignment. It is your responsibility, should you choose a Medicare supplement, to make sure that that doctor they are Medicare appointed. Okay, that gives you a lot of freedom to move around. Please keep in mind a Medicare supplement. They also call this a Medigap. This is not a PPO. It's not a PPO. This is a common misconception. This one, you have a regular monthly premium that you would be paying, and it's approximately, depending on the state that you're in or county, It can be anywhere from $150 to $175, possibly more, depending on the plan you choose. They are standardized plans. So basically this year, if you're turning 65 after January 1st, 2020, a Plan G is a Plan G, no matter who sells it. Legally, they are standardized by the government. So they all offer exactly the same thing. Where the variables come in, has to do with the rate they charge, how often they change that rate. It has to do with their guaranteed acceptance, whether or not you are a guaranteed issue. Their rules can be different per plan, and whether or not they offer extras. So those are the main differences. On this one, you're going to pay a monthly premium whether you use the plan or not. You are responsible for coordinating your care. There is no shared computer system or anything like that. So you would need to make sure that you take your information from doctor to doctor so that they have all your current information, should your medication change and that type of thing. There are no medical groups. You are not confined to a medical group on this plan. And there are no PPO restrictions. So the doctor does not have to be contracted with this particular plan. Everybody that is a Medicare appointed doctor will accept this plan. No questions asked. Okay, hold on for the next slide. Okay, Medicare supplements or Medigap plans do not cover prescription drugs. Drug coverage will need to be separate, either through a standalone prescription drug plan or other creditable coverage. Some people have amazing coverage through their employer, and you can keep that if you wish. So that's just one option. Okay. Let's see, the Part D prescription drug plan provides coverage for some prescription drug costs. There's two types of Part D coverage. There's a standalone or with an integrated Medicare Advantage plan. We've only been talking about the supplement at this point in time. So you would have to have a separate standalone prescription drug plan provided by Medicare, or you can have a separate individual plan if you wish. It just has to be equivalent, creditable coverage and equivalent to Medicare's coverage. Okay, so you would have to be enrolled in Part A and or Part B to get a prescription drug plan, and you need to live within the plan service area. The service areas are generally the county that you live in. So it just depends on the county. Everything goes by the county. Okay. Late de-enrollment penalty. This would apply if you did not sign up for Part D when first eligible and you did not have credible coverage for more than 63 days. You may have to pay a late enrollment penalty for as long as you have Part D. Monthly cost will have a penalty of 1% of the national base premium, which is $36.78. And you multiply that by the number of full uncovered months. So this penalty is per month. But as you can see, it'd be very small. So if your drugs are very expensive and you miss that 63-day window, the penalty would actually be quite small. So that is not too much of a concern, but I don't like my clients to have penalties of any sort. If I can help it, I will be after you to make sure that everything is in place so that we could get you lined up and everything's in place so you don't have penalties. Okay. All right. So this is the fun part. Changes happening to Part D with the Inflation Reduction Act. The Inflation Reduction Act was created to provide meaningful financial relief for Medicare beneficiaries, including improvements to Medicare. So the Inflation Reduction Act was specific to Medicare, not to employer group coverage or private insurance through like Covered California or anything like that. Okay, so it was passed in 2022. Their goal is to increase access to treatments and expand services, to provide affordability by lowering Medicare costs and limiting price increases, to make a Medicare program more sustainable now and in the long run. This has been a really incredible program for people that have very expensive drugs, and especially in the very beginning. And we'll go into that on this next slide. Okay, so one of the main things is your maximum out-of-pocket for prescription drug costs is capped at $2,000 for the year. This is incredible because in 2024, the maximum out-of-pocket was $8,000. So that's huge savings. You also can enroll into a Medicare prescription drug plan. They call it an M3P plan to help spread out your out-of-pocket prescription costs over the year. So say, for example, you have the bulk of your if prescriptions are very expensive. And in the first month, you hit that $2,000 maximum out of pocket. That's really hard for some people to pay $2,000 all at once. So this gives you the option to spread that balance, that $2,000 over what is remaining of the calendar year. So for example, if you start in January and you hit that $2,000 right away, it will be spread out over 12 months. If you hit it in April, then it will be spread out from April through December. So that's kind of how that works. Okay. There's a lot more to it, but that's the basics. Okay, so this for 2024, this just gives you the idea of why things have changed so dramatically for 2025 when it comes to Medicare. Your prescription plan drug costs may change annually depending on the coverage stage you are in. So this is based on the 2024 information. Stage 1 is a deductible phase, and the amount you pay before a plan covers your prescription drug costs. In this stage, you pay the full retail cost up to $570 of all of your prescriptions. Most of them, tier 1 and tier 2, for the most part, would not be a deductible phase. Basically, tiers 3, 4, and 5 only would have that deductible. Stage 2 is the initial coverage stage. That means you have fully met your deductible if you have one. The plan pays its share of the cost and you pay your share, and that's copays or coinsurance. A copay is when you pay a flat rate. Coinsurance is when you pay a percentage of the retail cost of the drug. Total maximum payments and plans payments, it'd be $5,030 before you hit the coverage gap or the donut hole. That's stage 3. The plan is limited in how much it can pay for your drugs. You will be responsible for 25% of the costs for covered drugs in this stage until you reach true out-of-pocket, which is $8,000. I mentioned that just a moment ago. So 2024, you were liable for $8,000 maximum out-of-pocket before you hit the catastrophic phase. Once you hit the catastrophic phase, you pay no more for your prescription drug plan, for your prescription drugs. If you still have a premium on your drugs plan, then you will actually continue to pay the premium, but you no longer pay the cost of your drugs. Now that's for 2024. Look how this has changed for 2025. Okay, so the Part D redesign program will consist of 3 phases only. Phase 1 is still your deductible phase, and that can be anywhere from $0 to $590. Again, this is only for tiers 3, 4, and 5 drugs, which would be your more expensive drugs. Tiers 1 and 2 are generally your generics, and those are typically zero deductible or deductible exempt. So your tiers 3, 4, and 5, you must pay that $590, and that's the retail cost of the drug before you go into phase 2, which is the initial coverage phase. The plan pays its share of the cost and you pay your share, which are copays and coinsurance, until your true out-of-pocket reach $2,000. Okay, there's no more coverage gap or donut hole. That is gone. And phase 3 is the catastrophic phase. So after you reach the $2,000 maximum out-of-pocket for covered drugs, you pay $0 for your drugs for the rest of the year. This is incredible. It's an incredible change, and it's helping so many people. The main thing on this is that your drugs must be on the formulary. Your drugs must be on the formulary with the plan that you are in. If they are not on the formulary, they would not count toward this $2,000. So that's something really important to note. Okay, hold on. I'm going to skip this part because it really doesn't have a lot to do. The numbers don't make sense. I'd rather spend my time on other explanations. Okay. So there is help for Part D drugs. And if you meet certain income and resource limits, you may qualify for extra help from Medicare to pay the cost of Medicare prescription drug coverage or Part D. Here's a website that you can check into to see if you qualify. There are countable assets, such as money in a checking or savings account, stocks, or bonds. Non-countable assets are either your home, you get one car, burial plot, up to $1,500 for burial expenses if you have put that money aside, furniture and other household items and personal items. The income is what is the most qualifying factor in this situation. You could have a very expensive home and brand new cars, and that doesn't count. So only the assets that is showing here as countable assets actually count toward what counts in to see if you qualify for extra help. Okay. So next slide. Okay. Part C. On this slide, Part C is what they consider the Advantage Plan. I'm going to spend a little more time on this than what shows on this slide. Medicare Advantage plans are offered by private insurance companies approved by Medicare and is an alternative option to original Medicare or to the supplement plan or the Medigap plan that we discussed a little bit earlier. This includes Part A, hospital coverage, Part B, the medical coverage, and your prescription drug plan. Not some of them offer the prescription drug plans. And Part A, B, and D equal Part C. Okay. Now there's two parts to Part C. There are HMOs and there are PPOs. Okay. So do not confuse a PPO with the Medigap plan or Medicare supplement. It is completely different. I'm going to start with the discussion of the PPO plan. And this is also managed care. But you can go in and out of network for a higher cost. This is also considered Part C Medicare Advantage. Okay. PPO are doctors who are contracted with that specific plan. And they would be considered in network. If a doctor is not contracted with a specific plan, they would be considered out of network. Many times the doctors say, oh, we take it. Yes, we take that plan. A specific question would be, are you contracted? Is the doctor contracted with that plan? Many times they'll say they take the plan, but they're not contracted, which would make them out of network. Okay. When you go out of network, you pay a higher cost. And that higher cost depends on the plan that you choose. Okay. Let's see. Most of the plans do offer dental, vision, hearing, over the counter, not all of them. There are also transportation benefits, fitness benefits, things like that are offered. Some of them have a monthly premium and some of them have a zero premium. It just depends on the plan. All of them have copays or coinsurance. And you on this particular plan of PPO, it's a pay as you go. So you only pay for the services that you use, unless you choose a plan that has a monthly premium. The only additional cost would be if you go to the doctor and you're going to pay, a copay for that. Okay. There are no referrals necessary. You can choose to go to any doctor you wish that accepts that plan. In or out of network, that's up to you. So that's nice because you don't have to wait for a referral. You can choose to go to any doctor. So that is definitely a benefit. Also, we're going to switch to an HMO. This is the most managed care. You actually have what we call a gatekeeper, which is your primary care physician. Your primary care physician is the one who gives you referrals, and you must go through your primary care physician for all referrals to any specialists, things like that. If you have an urgent situation, you're trying to get into a specialist, this can slow down the process. It's important to know. But this is going to be your most cost-effective plan. They have different plans that are set up for chronic conditions and things like that, but it is managed care. Most of the premiums on these are zero, and there's no medical deductibles. You must stay in one medical group. That is the most restrictive, but many of the medical groups are huge. For example, in South Orange County, I can give you some examples for is Hoag. UCI is a medical group here. Also Memorial Care. There's many others. There's Optum, Monarch, Optum, and the list goes on and on and on. So the medical groups can be huge. It does give you a lot of choices. But if you need that specialist that's outside of your network, they will not pay for it. So that is definitely something you need to consider as well. These plans offer usually more rich extra benefits, such as your dental, vision, hearing, your over-the-counter benefits, acupuncture, acupressure, chiropractic, transportation, and other benefits. Keep in mind that gatekeeper will slow down the process of you getting to see somebody that you really need to see, possibly more urgently than in a month or so. Okay, that's an HMO, that's a PPO, that is your Part C Medicare Advantage managed care plans. Okay, I hope that helps you distinguish between a Medicare supplement, Medigap plan, and the Medicare Part C. Okay, your Medicare Advantage plans. Here's the enrollment periods. Enrollment period, the initial enrollment period is, they call it an IEP, is a 7-month turning 65 election period. So it is 3 months before your birthday month, the month of your birthday, and 3 months after. Annual enrollment period is AEP, and that is October 15th to December 7th. Open enrollment period is right now, it starts January 1st and it goes to March 31st. Lock-in period is typically from April 1st to December 31st. However, there are special enrollment periods that help us navigate that lock-in period. And there are many of them. There's over 30 pages. They're very specific in what they allow. It is governed by CMS, which is the Centers for Medicare and Medicaid. So it is government regulated what special enrollment periods we can use. There are many opportunities to switch a plan. If you get into one that does not work for you and you need to change, that is always an option. That is where I come in. I have many opportunities and many things that I can help you with if you should need to change a plan. Okay. Next one. Medicare supplement enrollment period. That is the Medigap plan. That is a little bit different. It is a 6-month window that begins on your Part B effective date or 65th birthday, whichever is later. No medical underwriting during this period of time. It's guaranteed to issue. That means no medical underwriting. And you can choose from any Medicare supplement plan options. And that's really incredible too. These are really good plans. All of them are amazing plans. It just depends on your situation. Okay, so guaranteed issue for the Medigap plan. There are several other guaranteed issue situations to enroll into Medicare supplement with no underwriting. So loss of employer coverage is one, that'd be whether it's through you or a spouse. You're moving to a new area, and there's many, many more. There's at least 16 different options on this, and it depends on the plan, the carrier, I should say, or the insurance company. You also get a 12-month trial period if you decide you want to go to a Medicare Advantage plan and try that out. and see what that's like. We have several clients when the Medigap, the Medicare supplement plans get very expensive as you get older, talking late 70s, early 80s. And some people really need to save some money. They may choose to try a PPO plan. So you get a 12-month trial period where you can go back to the Medicare supplement plan. All plan options may not be available at that time, but you would be put into a plan that is equivalent. If you do not qualify for guaranteed issue, you may need to undergo a medical underwriting, which, if you have a chronic condition, can be rather difficult or can cost you quite a bit more. Okay. Okay, star ratings. Before we do star ratings, I do have an example of a client that I switched from a Medicare supplement plan and to a different plan, and it saved them a considerable amount of money between that and changing their prescription drug plan. So let me tell you about that very quickly before we go to the start ratings. This person was a 76-year-old male, non-smoker. He was on a Medicare supplement plan F with a specific carrier, and he was paying $404.87 for his monthly premium. I changed him to a plan G with a different carrier. There are some differences between the two, but very minimal. Plan G cost him $246.86, which is a savings monthly of $158.49. When I showed him the plan options and the differences, he was more than willing to make that change. I can get that more specifically, individually with each of you, if you wish. There's also, with the Medicare supplement or Medigap plan, there is a prescription drug plan standalone. He was on one. He took two generic plans, two tier 1 generic drugs. He was paying $124.80 premium every month and $16 for the drugs, which was $140.80. I got him on a plan with a $1.80 premium, and his drugs cost him $9.50 now, for a total of $11.50 is what he's paying for his drugs and his prescription drug plan now. That's a savings of $129.30 every month. So he's saving, just by doing those two changes and taking a look with an open mind, he saving $287.79 a month, or amount total for a year is over $3,450. It's worth looking into changes. Even if you're on a plan now, it's so important to look at everything, because the plans are the same no matter who sells them. They are standardized plan. I'm talking about Medicare supplement plans with a standalone prescription drug plan. The Medicare supplements are standardized no matter if it's a plan G, it's a plan G, no matter who sells it. So keep that in mind. That's very important to know. Okay, star ratings, here we go. All right, so each Medicare Advantage plan is assigned a star rating from 1 to 5 stars. It's based on member satisfaction surveys, plans, and providers. Performance measurements are based on more than 50 key factors, and additional information is available on Medicare.gov. The star ratings are important because that is what gives the insurance companies, they base the star ratings onto how much income, how much money they get for the government for each different plan, and how much they're able to put into the plan to help their beneficiaries, which are you. Okay, so the more higher the star ratings, the more money they have to be able to help make the plans richer, more equitable, and easier for you to afford. Okay, you have options, and I'm here to help. You can decide if you want to continue with your employer coverage. If that is working well for you, but you want to look at Medicare, I'm here. I do analysis for my clients all the time. And I'll show you side-by-side comparisons, and then you make the decision if you want to change or not. You can continue with your retiree or military plan if it's applicable. You can enroll in a Part C Medicare Advantage plan, which can include your Part D prescription drug coverage. And you can also enroll in a Medicare supplement plan with a standalone Part D prescription drug plan. I can help you with all of that. During an appointment, we would review your needs to help you find the right plans for you to choose from. And it's like, when does your Medicare start? There's some of the questions. What zip code do you live in? Because everything is pretty much based on zip code or county specifically. Do you have a primary care doctor that you like? I really try to keep people with as many of their primary doctors as possible, and your specialist is very, very important to you. Do you take any medications? What are they? What are the dosages? I'd like to make sure that you are covered as best as possible. And are you looking for a specific service? Do you need transportation? Is fitness important to you? All of those things. I'm able to take that information and make the plan as specific to you as possible. I do a very thorough job. If I have to call all of your doctors and find out what plans they take, I do that for my clients on a regular basis. But I'm here for you. This is your healthcare plan. It is not mine. I am here to show you what options you have, and it's your decision. If you have additional questions, I'm here to get the answers for you. Or if I cannot help you personally, I have a huge agency. I have a huge agency that I work with. We have about 100 agents now. They offer services in all different states, and they sell some plans that I do not. But I'm more than happy to refer you off to someone that I'm comfortable with that will take care of you very, very well. That's the end of my presentation. And I hope you learned something, and I'm here to answer any other questions you may have that I did not cover. Okay. Thank you so much. And I look forward to your questions.
Thank you, Adrienne. If you,
Sure.
You're welcome to stop sharing screen if you would like to, and that we can have a full view of you. And
Okay.
anybody that has any questions, you can go ahead and start putting it in the Q&A box, and I'll start reading them to Adrienne. And while you're getting ready, I really appreciate this information because, wow, it's a lot to take in. And I don't know if people realize just how confusing it can be with all these different parts. I mean, until talking to you, for me, I thought you pick them, you're on Medicare and your whole life changes, but it's not like that. There's so much more to it, and all these
Right.
different parts and what you have to pay for and what you don't. And one of the
Yes.
things that I thought was a couple things that you were talking about that were really important is for people to understand that when you're looking at these plans and it's so overwhelming to see how expensive some of them can be, then you say, you know what, these HMOs look very tempting. And you go
Yes.
with these HMOs because it's almost zero to very little out of pocket. But
Mhm.
then you said it, if they don't have the coverage for your specialist, you
Mhm.
can't see them. And
Right.
there's a lot of people who have picked a Kaiser plan. And what's so nice about Kaiser is you've got everything you need right there, including all of your prescriptions. But then when you want to go outside and see a scleroderma specialist, then you've lost the opportunity to see them. And very often they're not going to refer you outside of that
No,
network, which
no, they don't.
many of you already know. But I just
Mhm.
want that to be, I can't tell you how many people have come back and said, I regret picking an HMO because I didn't realize that it was going to hinder my opportunity to see an outside specialist. And so being able to talk to somebody such as yourself that can really educate somebody on that decision. And you also mentioned this period where if they want to change and some of
Mhm.
the SEP, I think it was what you were talking
Yes.
about. And I think that this is really wonderful that there's an opportunity, and really that talking to you maybe individually allows people to understand more of just what that looks like in case something has happened where the plan that they have picked is not working for them. And I think that the other thing I thought was really great was that you talked about in, the employee coverage versus making that switch. And that you're going to make sure that if you're talking to them, and usually anybody in your profession, if this is what looks better for them, you're going to make sure that they know that, versus taking one of these plans. And I think sometimes people won't know until they talk to somebody that for you, you understand all of it. And for us, it's almost like a foreign language, and just
Right.
having somebody that can do that. And what I want to encourage everybody is, after we do this recording and I send out the recap to all of you and you have this contact information, go over this again and take your time, pause a slide, make your comments on a piece of paper, and then set up an appointment to have a detailed conversation about some of these things that were confusing, or that were an eye opener to you, and were able, and as a result, it gave you an opportunity to, now you have questions that are going to benefit you when you're making this decision. So I just wanted to say that before we open the floor to the questions, but really appreciate the information, because like I said, a couple times I was like, this is daunting. This is so much information over all these little places, and who knew that there was so much? At least I didn't. So
Right.
very much appreciate that. I'm going to take a peek at the Q&A here.
Okay.
And let's see, go back down here. Okay, so do you take out-of-state clients, or do you have a referral? I'm in Illinois.
Yes, I can get a referral for you. Absolutely.
Yeah, so Lydia, I would make sure that you reach out, because I'm going to make sure you have her contact information. And Adrienne and I had talked about this before. We knew that this talk would be acceptable for people in other states, because it was covering the same information. But if you needed somebody in that area, I like that she'll make sure that she puts you in touch with somebody that she trusts and respects. So
Yes.
you'll have that information. Valerie, I have scleroderma and I'm currently on my husband's employer plan, which expires when he turns 65. I am 18 months younger. What options do I have for the 18 months until I qualify for Medicare?
There would be several. Are you in California?
Can you tell me, Valerie, are you in California? You could go back to the Q&A and just tell me yes or no and where you're at. That would help me. I think she just did. Yes, she's in California. Thanks, Valerie.
Okay. There are a couple of options. I can put you in touch with somebody that does cover California. He's one of the agents that I work with. If that's something that you're interested in. It's not that it's very reasonable, though, keep that in mind. But covered California would be one of your options. I'm sure there are many more. I am a Medicare specialist, so I can really only speak of that, but I can reach out to my agency to see if there's any other options besides covered California if that one doesn't work for you. But I'd be happy to give you the person's name if you want to reach out to me separately. And that way I can let him know that I referred you, and he'll be expecting you to contact him. Okay.
Thank you for that. And it's good to know that if this is something that she herself cannot assist you on, if she has the opportunity to refer you to somebody, that she's going to make sure that you have that information.
Absolutely.
So thank you, Adrienne.
Uh-huh.
Does your company also help with SSDI eligibility?
Eligibility. That is actually Social Security. Again, we are Medicare. Are you SSDI eligibility? My question on that is, have you tried applying, and is there questions? That's a really tough one to qualify for.
Yeah. And Karen, if you are looking into SSDI and you haven't yet, again, she's just here for Medicare, but not that part. We do have a talk, though, on our video library that a woman goes, that a then an attorney did a talk for us during the pandemic, a great talk that covers a lot of this information. And
Oh,
I think that that would be something that I could share with you. But I don't know where you stand. But Karen, we can always talk about this outside of this talk, and I can address your concerns and get you to the right people.
the other thing, Karen, that if you're close to 65, getting onto SSDI can help you with Medicare, but you have to be on SSDI for 24 consecutive months. And on the 25th month, they put you on Medicare. At that point, I can help you. But this SSDI specifically is through Social Security. That doesn't have anything to do with me. I'm sorry.
Thank you, Adrienne.
Mm-hmm.
My sis has scleroderma. We have applied to Social Security for disability last October, and we're still waiting. If she gets accepted, then it's 24 months after that. She might be able to go on Medicare, question mark. She is 60.
That is true. Yes. And there are times that, and I don't want to speak out of turn, but I have heard clients tell me that they were able to get Social Security to more or less backdate the application to where they're covered for, before, like not the date it's accepted. So that might be something you can try to discuss with them. But yeah, so she just needs to be on the Social Security disability for 24 months, and on the 25th month she would automatically be enrolled into Medicare Parts A and B.
Thank you, Adrienne.
Mm-hmm.
And it's good to know that I've heard many say that once they do get the approval, that there is a lot of backdating and getting them covered from when they first started the process. So,
Yeah, I think that's wonderful. So hopefully, yeah, good luck.
thank you. Do you require an in-person interview, or can it be done by phone or Zoom?
Oh, anything you like. Um, yeah, I only travel so far. So like to go, I'm in Southern California. So to go, to Northern California would be a little difficult just for a visit. So Zoom or the phone, we can do anything that makes you comfortable.
Wonderful. Thank you for clarifying that. Okay, thank you for meeting with us. I'm 34 years old with scleroderma, and I see a lot of specialists. I have Blue Cross, Blue Shield, PPO, Medicare, Medicaid. My questions are having problems getting my inhaler for asthma and my 2 migraine pills. The formulary inhalers I cannot take due to celiac, but the other one has a pill similar, but won't accept state or Medicare insurances. The other pill I received a letter today. Will I continue to get these medication letters? How would you go about that? And are you accepting new clients? I'm interested.
I am accepting new clients. What I would like to do is talk to you more specifically on that topic. I would need more specifics on the medications, the names of them, the dosages, what you're running into. But if it's okay with you, please reach out to me. And I would love to speak with you one-on-one on that. Okay?
Thank you, Adrienne. And can I say, Jacqueline, that Adrienne and I were actually talking about some of these issues that come up with medication, and she was using Actemra as an example of some of the things that she's gone through trying to help people with some of these types of issues. So as she said, I'm sure it's very individual, each person going through these different things, but it sounds like she's willing to listen, ask you the additional questions, and see if she can help you. So I think that's wonderful. And again,
Absolutely.
on the slide I had it, I'll send out an immediate email with her contact information. And then when we have the recording, I'll send that out. But just in case, to make this easier, I'll make sure that you all have her contact information.
Thank you.
Okay. My sis is low income on covered California PPO, and they increased the monthly premium to $800. That's ridiculous. Wow. Why would that be? Adrienne, is it just with the changes? I mean, this is crazy.
Covered California, is that what she said it is?
Yeah, and being low income. I mean, obviously this isn't your full wheelhouse, but I mean, do you have a comment for that? Or is
What was she paying before? Do we
Gail,
have
if
that?
you can type that in, let me know. Oh, she says, unfortunately, she moved back to Kaiser at
Oh,
79 month. I'm not sure what that means. She was paying 650 before, and now it's 800.
oh, 650.
I
Okay,
mean,
well that's
even low,
yeah,
not low income. 650 was even high, if you ask me.
yes. So when you say low income, does she qualify for Medi-Cal?
And now she's only paying $79 per month for the premium for Kaiser. And again, this is what we talked about. So this is wonderful because she's only paying $79. But if you're a
How
scleroderma patient and you need to see a scleroderma specialist, 9 out of 10 times you won't get the referral.
how old is her sister?
Gail, if you can put that in here somewhere, that would be helpful. And she did not qualify for Medi-Cal, which is 23K a year. She is at 25
Oh,
and
yeah.
she's 60.
She's 60. Okay. Yeah, covered California is not the answer for everybody. They do have a tendency to run it a little high, as you're seeing here. Um, the decision is 25 a year. Yeah, that's going to knock you out of Medi-Cal. Um, yeah. Oh boy, I hate to see you being on Kaiser only because again, it's an HMO, and my guess is you probably need more specialized help. Um, And again, I'm a Medicare agent and I don't know all the ins and outs of the other insurance companies, but I can reach out if you want to reach out to me and give me some more specifics. I can try to see through my agency if anybody else has any other contacts with non-Medicare under 65 programs. Okay.
And that would be helpful for all of us because
Hmm.
I have other, families that are not at the Medicare age or the disability to qualify them early and
Right.
have these types of questions. And I don't have, this, a wonderful lead for them. So maybe if you end up finding somebody that is willing to answer these questions, maybe that will continue to be our go-to
Okay.
types of
Okay,
questions.
I'll see what I can do. Hmm.
Gail says, thank goodness I'm an incredible advocate and she had great specialists the last 2 years and I learned a lot on her behalf. Thank you. I'm glad that you're a great advocate too. I wish everybody had that opportunity, Gail.
Yes. Yeah.
That was the last question that I see here. I'm just going to give it a minute and see if there's anybody else. And if not, if there's just any comments that anybody would like to throw Adrienne's way or my way, and we read them, that would be fine too. And then we'll end it. Let me remind you that I'm going to make sure you all have the recording once we have it edited, because I'm going to edit out all my mistakes in the beginning, trying to get Adrienne on. And but I will send out an immediate email to everybody that registered and make sure that you all have her contact information in case you need it immediately. Okay,
All right.
I think that's about it. I'm going back through them. Let me see if I missed anything. Anna, thanks, Anna. I also would like to have a referral in Illinois. Valerie, thank you. I need your help and we'll reach out. Yay, Valerie.
Okay. All right. I look forward to it.
Yeah. Marissa, thank you. Good info for the future. See, and that was the other thing I wanted to remind people. You might not be there yet, but you're getting there, or you might be disability is coming up and you're going to qualify. And now you have these questions that are coming that are going to come into play. So this is something that I'm glad we're going to have in our video library. So when people need to look back at this, I can say, hey, here's some information to help you for now. And I guess, Adrienne, what we can do is if there's changes that come up that you think are definitely important, then we should do
Yes.
updated talks and recordings to make sure that our families have the most updated information as time goes on. But for
I
now,
agree.
I'm glad that you looked into things to make sure that this covered what people are looking at in 2025.
Right. And also, if you have any more specific questions, um, such as the ones, we had discussed, and I was saying, call me or get a hold of me separately. I'm always here to answer any questions you may have. So please do feel free to reach out to me. Whether you're before, Medicare available, eligibility or not. If you just have questions and you need information, I'm more than happy to help you out. And I can't thank you enough for being here and hearing my presentation. I really appreciate that. And I look forward to being a resource to all of you. Anybody that you know that may need help, please give them my number. I'd be happy to talk to them.
Yeah, thank you so much, Adrienne. And Jacqueline said she will be reaching out with her questions and
Okay,
about medication and whatnot. And thank you.
perfect.
There is a
Yeah.
time change. So, Jacqueline, right now in California, it's 11:12. I think you're 2 to 3 hours ahead of us, but I can't recall if it's 2 or 3. And
Okay.
Anna said she'll be reaching out as well. And yeah, Kelly, I'll make sure you have the information.
Okay, great.
Okay.
Okay, thank you so much.
All right. Well, I still want to just say thank you for everybody to take the time out of your day this morning or afternoon for some of you to listen to this great talk. Adrienne, thank you so much for taking time out of your day and making sure that we have the most accurate information so people can make a great choice. And again, I'll get this out to you guys ASAP because if you're in that process before open enrollment closes and you want to get this done, it's important that we make sure that we cover it for you. So thank you again, everybody. Have a wonderful rest of your day.
Thank you.
Okay, bye.
Bye-bye.